dude. I'm looking at Harlequin and Bubba Kush. You know that was my first strain, Karen? Harlequin was my first CBD strain.
So this is about your father?
That's correct. They found a tumor in his liver the size of a large marble, apparently. They can maybe prolong his life if he does chemo. He doesn't want to make himself miserable just to live a little longer.
We get about 300 calls a week from all over the world. We used to have people who would never even want to talk about it, let alone have it in their house. And now I have 80-year-old women telling me they want more because they feel so great using it.
You want to have as wide of a ratio as possible between CBD and THC.
Well, that will differentiate those who are selling to the recreational market and those who are truly medicinal producers. You know, this is what we've been waiting for, right? When we really, truly get to play in the science. Yes, yes.
There's competing.
I very much want to have
competing
access to non-killer forms of cannabis. I think whole plant artisanal medicine is the future, not the past.
I didn't think a company like this existed when I was doing my research. They had the scientific vision that I was looking for. They're doing it right.
I have some wonderful news to share with you.
The beautiful boys
So here's
stab me in the back.
The company is Constance Therapeutics, a medicinal cannabis producer for the medical community industry. She can't fill the orders fast enough, and the demand is literally exponential. ... Only in San Fran. Medicinal cannabis industry growing at ridiculous rate.
Constance is a pioneer. She has more experience with this oil than just about anyone in the world.
When I see that texture, I am positive how it's going to taste.
This is really
What's
a
the
great
cannabinoid content
It's
been
true.
running in this?
It eliminates the need
Oh, wow.
To bring in, yes.
From just the blueberry, that definitely passes both chlorophyll and residual solvent. Both CBD and THC kill cancer, but THC is much more efficacious, and CBD is much more helpful as a synergistic aid.
It's ironic, isn't it? That
There's another one.
the gateway drug, the dangerous drug, the prohibition for 70 years, turns out to be one of our greatest allies in cancer therapy. Who knew?
2.5 years ago, I was diagnosed with stage 3 breast cancer.
Stage 4 had that cancer.
Metastatic cancer in all my perpendicular bones.
Okay.
Grade 4 glioblastoma in my L1 spinal cord.
They found another growth in my intestine a week ago, and it was benign.
The results I've had in conventional treatment have been extraordinary, and in some cases everybody's sort of scratching their head.
The cancer has been static. It has not moved in 2 years, and it is the oil that has done that for me. As far as I know, I no longer have cancer, and I credit it to Constance's oil.
The anecdotal stories were enough for me because I'm going to be one of them.
I think one of the reasons that Constance Therapeutics oils are so effective is the way that they're made.
We use the most valuable part of the female cannabis plant, the beautiful flower of the plant, where a majority of the medicine is made.
Constance Therapeutics has the most unique standardized oils in the cannabis extract space and has accumulated more clinical experience in using them with patients across a spectrum of serious diseases, cancer to Lyme to neuropathic pain to autoimmune disease.
My pain levels dropped considerably right
That's
away.
I'm a walking example of one of my
what could happen even with a bad diagnosis.
We think the oil has a lot to do with my great results, and I've been cancer-free now for about 7.5 months now.
Anything else that I've used hasn't even come close to this.
Saved my life.
Cannabinoids are a class of molecules that interact with the cannabinoid receptors in our endocannabinoid system. So it's sort of like the operating system of your body.
I have a very debilitating autoimmune condition. The levels at which most people found relief, I didn't find relief from. So what I ended up developing was an unheard level of potency in the cannabis oil. I now have taken more cannabis oil than probably anyone in the history of the world. We've been doing this 7 wonderful years. Other than the Moroccans, I think we probably know more about it than anybody.
So this has become nearly a miracle plant, but we're trying to demystify it a little bit and understand which ratios of these cannabinoids, THC and CBD particularly, are necessary to treat each of these diseases.
When you take a drop of our oil, you can know with certainty that it's exactly the same drop of oil you took last time, down to which strains, down to which varieties of indica and sativa. So in preserving the genetics, in working with soil health to a fanatical degree, and then additionally standardizing, so that people can come to the medicine and know it. That's really a critical part of what we've done.
Anybody who's interested in medicine is going to be very excited about cannabis over the next few years, because you're going to see something that world-renowned doctors are going to be having meetings
Got my
about.
life back and found that I could help other people. It was so compelling that there wasn't anything else really that has existed for me for the last 7 years. Puppies! Let's go! Let's go for a walk. For about 6 years, I couldn't leave my home, couldn't lift pots, couldn't open doors, couldn't hold books to read. It was kind of like being buried alive. At 10 years, I was finally properly diagnosed as having ankylosing spondylitis. I turned to cannabis because friends were pushing me to consider it. Doctors that I worked with were very famous, and they said, why are you better? I said, I'm legally making cannabis oil. He looked at me in my shaking hands and said, everyone here needs that. To my personality, that's like a match to paper. And that's the joy of life, to be able to do something new.
She's the best. She's passionate, just really believes in what we're doing, and really wants to be the best and do the best for everyone.
We are going to stay making the best cannabis oil, if I have anything to say about it. I want us always to be putting our intelligence, resources, energy into bringing the world what it needs in the best way possible.
Isn't it exciting that patients in Hawaii will now have access to medical cannabis? Hello? We are pleased, honored, excited to be in your first medical expo here in Hawaii. Hawaii's incredible soil, culture, growing conditions, healing environment, and warm people will move it to the front of what cannabis has to give the world, we believe. We think it's an auspicious time to be involved in Hawaii and in cannabis. So as you saw in the film, I never expected to be standing here talking about cannabinoid therapeutics with you guys. I never even knew really if I would be alive when I thought about 2016. But because of cannabis giving me my life back, I'm here on a stage, happy to be in Oahu.
We'll turn this right there. More directly.
So speak right here? Okay, thank you. So some of you know that I began growing cannabis indoors in 2008, to be exact, in a historic noir out, and cannabis buds came in. It was important to me that what I did with the cannabis molecules was not to bring a single molecule pharmaceutical type of focus, but rather, and also to not have a backyard production facility made from the garbage from harvest and given away out of charity. I felt that the world deserves something better than either of those options, and that's what we at Constance Therapeutics are striving to bring you. We want to bring you cannabis that is influenced by herbalism. Herbalists have worked with plants for thousands of years, and they know how to make it safe in our bodies. And that's what we do at Constance Therapeutics. I want to talk to you a little bit about the science. Some of you may know a lot about it, and some of you may know nothing. So let's talk a little bit about the endocannabinoid system. In our bodies, we have a cannabinoid system. We can call it the endocannabinoid system or the endogenous cannabinoid system. There's little receptors all throughout our body that relates to our endogenous cannabinoids as well as to the plant-based cannabinoids. They're in our immune cells, in our gut, in our brain, in our muscles. We continue to discover new locations where these receptors are expressed that match the endocannabinoids. We're beginning to understand the important role that this system plays in our cognitive development, in our physical processes, in our emotional well-being. Many scientists now believe that the endocannabinoid system is actually the underlying regulatory system for all the systems in our body. And that's why when people used to say it can't be this positive, nothing can do this much, this sounds like snake oil. Well, now we know the scientific reason. It isn't snake oil, folks. It is actually regulating everything in your body. So what happens when it becomes imbalanced? A lot of us actually got involved with cannabis because we had an imbalanced cannabinoid system. When you look at morbid obesity, when you look at liver fibrosis, you look at inflammatory bowel disease, that's what happens when the endocannabinoid system becomes imbalanced. Even in cancer, when we look at cancer patients, we see that they are expressing many, many, many more receptors, so that it's imbalanced, and they're postulating that that's because the body is trying to reach out for what it needs to heal. It's looking for those endocannabinoids. So then we move to the phytocannabinoids, those that come from the plant. Specifically, the female cannabis unfertilized plant. Those phytocannabinoids stimulate our receptors just like our internal ones do. The most abundant of the phytocannabinoids that we've studied the most, that we talk about the most, THC, CBD. So let's briefly talk about THC. It's the phytocannabinoid that's primarily responsible for cannabis's psychoactive effects. It's the part that gets you high. It has well-documented properties that can be applied to conditions such as insomnia, neurodegenerative pain, anorexia, cancer, Lyme disease, PTSD, multiple sclerosis. So when we think about THC, instead of just thinking about psychoactivity, let's think about anti-tumor, good for sleep, good for severe and chronic pain, excellent for seizures, metabolic regulation, anti-inflammatory, very powerfully, being present to sensory awareness, increasing sensory enjoyment. Palliative uses increases the appetite at certain doses. Let me tell you a little story from Harvard University. Spring of 2014, they looked at THC and the people who used it a lot and what was their relationship with the munchies, okay? THC does cause the munchies in the dose that we usually take it, but what the Harvard study found is that people who regularly smoke cannabis, this is really interesting, people who regularly smoke cannabis eat about 1,200 calories a day more than other people, but guess what? They have less belly fat, substantially less belly fat, 22% less belly fat. This is Harvard, folks. And while we're on that pathway of metabolic regulation, of regulating body fat and addressing one of the biggest health problems we have today, let's talk about CBD. The Chinese government knows that CBD can actually cure diabetes type 2, and they're spending billions on it. This is the government of China. So, what else does CBD do? It's primarily non-psychoactive, but because I used to be a psychologist, I like this to be precise. So I say it is psychoactive in that it focuses you. It's extraordinarily helpful with distracted people, ADD. I have a friend who passes her boards first time on RACDC. Couldn't study without it. So it has some other interesting and exciting properties too. It's anti-spasmodic. Maybe many of you saw the Sanjay Gupta weed show where the young man had the spasming stomach. He takes a hit of CBD and it resolves what 68 medications couldn't do. It's anti-seizure as well. It's anti-tumor as well. And it works synergistically with THC to enhance most of the THC's effects. It's serotonin enhancing. All of a sudden, you're having a really nice day. It's anti-nausea powerfully. Promotes bone growth. Why are we not hearing about this? For menopausal women, it promotes bone growth. It increases focus, and again, it's anti-inflammatory, very, very powerfully, and from a different pathway than THC. So let's talk about CBD's interactions with the ECS, the Endocannabinoid System's receptors. They're very complex. THC and CBD relate sort of differently, but when you put them together, it becomes even more complex. And we think this is an essential part of the picture, putting it all together. Since you in Hawaii have not had the kind of wonderful access that we have had in the medical state of California, I wanted to talk a little bit about the medical cannabis products that are going to be coming your way, and to give you a little bit of advice from our viewpoint as to what to look for. So there's some difference between direct ingestion and edibles. And we at Constance Therapeutics have great respect for those in the industry making high quality edibles. Our bias is towards direct ingestion without an edible around it. We are working to be the cannabis oil pharmacy for the physicians, and we want it to be direct. We think that there's problems using edibles for medicine. There's no problem using them for enjoyment. I want to talk a little bit about the difference between inhaling cannabis and inhaling tobacco. You all in Hawaii have an amazingly proactive stance on smoking. You're kind of leading the nation here, and I think it's very important to contribute as you move towards cannabis being medically accessible, that you know there are differences between smoking tobacco and smoking cannabis. So Professor Tashkin, in 2005 at UCSD, he gave up in a 5-year study funded by our government, trying to prove to all of us and everyone assuming that he was correct, that smoking a lot of joints gives you lung cancer. Well, it doesn't. So what he found is that there's a very strong dosing relationship between tobacco and lung cancer. But with cannabis, he could establish no causality. And in fact, what he found is that heavy tobacco smokers, who also were moderate to heavy cannabis joint smokers, had a 38% less incidence of lung cancer. That's kind of mind-boggling. Now, I'm not recommending that people use joints as their delivery system or that they smoke. We use vaping, and we're very, very picky about what hardware we use in vaping. A study released yesterday by UCSD, the same school, shows that additives in e-cigs, and here we're talking tobacco, but the additives and the flavorings are highly carcinogenic, as is the viscosity agent. So as you move to considering whether or not to vape your cannabis, think about the hardware. Think about the additives. We have a patented pending viscosity agent that is incredibly good for you, and we hope at some point it's going to be available to you guys and everyone around the world. Quality control is pretty non-existent in those products, so pay attention. Try to look for real titanium, real glass. Unfortunately, they're not labeled correctly either. So let's move past vape pens to the cannabis itself. How do you choose the product? When we're lucky enough to get to choose our products, right? Where was it grown? Was it grown for ingestion, or was it grown to make fiber? Was it grown in organic soil, or was it grown in toxic soil because no one had any intention of ever putting that in your body? There's a lot of products on the web right now being sold as CBD that comes from industrial hemp from Europe and other places that it takes years to clean the toxins out of soil with hemp. And later, I have Danny Fontaine. In a few moments, I'm going to introduce her to you, and she's going to talk to you about hemp in Hawaii. Is your provider taking care to stay legal? Lots of people pretend to be legal and do things out the back door. Don't deal with those people because you and they are at risk. And we all know about the green rush, right? All the money coming down the pike. Everybody has now discovered that this is the new way to make money. Try to deal with people who actually come heart motivated and industry aware. So we at Constance Therapeutics believe that medicine for seriously ill people should be made only from tightly trimmed, highest quality female flower, the bud. Terroir is a word we use a lot. It comes from the wine industry in France originally, and it means that an agricultural product, the wine, should reflect the place it comes from. If it's growing in stone, it should taste like stone. And if cannabis is growing in some of the most productive volcanic dirt in the world on small islands in the Pacific Ocean, that terroir should become famous. We believe Hawaii will take its place with Northern California and Amsterdam to be one of the 3 most exciting places to experience cannabinoid therapeutics. So let's talk just a tiny bit about symptoms, time of day. How do you choose your product in that method? So we like to manage symptoms with your individual body in mind, with the individual strains, the different ratios of CBD and THC, what disease or what illness you're suffering from, and how much awareness and history you have with cannabis. We've coined the terms canna sure and canna shy, meaning I know nothing about this, or hey, I got it. We like to talk about nighttime, daytime, anytime. We use indicas at nighttime. We often use sativas during the day, and our CBDs can be used anytime. So some patients might leave our appointment time with a CBD vape pen during the day to increase focus and hopefully to help their sleep a little bit from focus and being more awakened during the day. They might take a vial of high THC from an indica that will really help them sleep at night and reduce the inflammation and pain substantially while they're sleeping. They might take a vape pen that is a creative sativa up that is infused with herbal other essential oils that help the product be more enjoyable and do its job better. It depends on the person, it depends on the disease, it depends on what we're trying to do at what time of day. So to summarize, we at Constance Therapeutics believe what differentiates us, keeps us the thought leaders in the medicinal cannabis space, is maintaining specific known genetics from growers in our collective. Third-party testing at each step of the process, or as we say in our office, out the wazoo. Standardize multiple formulations that allow precise dosing and professional coaching. So we're looking to move forward in something we call whole medicine, meaning that people shouldn't have to choose, doctors shouldn't have to choose. It should all be in the doctor's toolkit. You should be able to go to your doctor and hear about cannabis that he or she has been trained in medical school and knows just as well as they know the uses of COX-2 inhibitors, okay? We believe that acceptance of this plant involves not just a little shift in policy, but a big shift in culture, and that we're headed to a kinder and a gentler world when cannabis is more widely available. The times are changing, and thankfully medical cannabis is no longer a radical notion. It promotes affinity with each other. Us humans like each other better when we use cannabis. And we're now at a defining juncture in which what we do today is going to determine what's going to happen for a really long time. It's very important that we go forward consciously, carefully, and that we bring what this plant has to offer to Western medicine as well.